Good afternoon, everyone, and welcome to Pioneering Pensions. For those who don't know me, my name is Stefan Lundberg, and I have a passion for pensions. The purpose of this webinar is to share the knowledge we have, talking to experts in different fields of expertise. And this time, we're going to talk to Dr. Samir Sinha, and he's a geriatrician, so quite a different topic from what we're used to. And the purpose here is actually as much as for us to have a conversation, but also for you who in the audience to be able to ask your questions. Unfortunately, we do have a technical problem, so we couldn't get a video on Samir, so he's with us with voice only. So I hope that won't be a problem because he's a good-looking guy, but what he has to say is even more interesting. So with that, I would like to introduce Dr. Samir from Canada. He's the Director of Geriatrics at Mount Sinai, and he's also Director of the Health Policy Research at the National Institute of Aging in Canada. So Samir has a good experience of both the saving side and sort of the health side. And he has advised hospitals, both in the UK, in the US, in China, and other places. So he's quite well versed in the international context as well. So if you have something, if you're not from Canada, he might actually know a little bit about your healthcare system as well. And I think this is really important because when you're getting old, health is perhaps the most important wealth you might have. So with that, I welcome you, Samir.
Thanks for having me, Stefan.
Yeah, I'm looking forward to this discussion. Before we dig into the content, can you please tell us what your geriatrician is and what you do?
It's a great question, actually, because the New York Times has actually declared geriatricians to be a rare and endangered species of physician. And that's because while we now have more older people and younger people, say in Canada, we have about 10 pediatricians for the same number of one single geriatrician. And the geriatric medicine is actually a generalist specialty. It's a specialty where we do extra training beyond medical school so that we can have permission to care for the whole patient. And so often the patients we're seeing are not just simply chronologically mature, they often have a number of different health and social concerns that are often interacting at the same time. And so our job really is to kind of do a comprehensive assessment and try and find the solution that works best for the patient by managing all of their concerns and working with their specialists and their primary care providers. And so people say, what is your typical patient? And I often say, Stefan, that for geriatricians, when you meet one older patient, you've met one older patient. There's no typical patient, but often there are individuals trying to maintain their independence. And it's our goal to see what we can do to do that.
That sounds like an exciting job. And of course, I need to ask you now, this is like quite a sneaky question, but what is the key to a long and happy life?
Yeah, so often when I see number of my older patients, I think the key is that I've learned over time that obviously your health is really important to your overall well-being. If you're not healthy, it's going to be hard for you to enjoy the rest of your life. And so often we talk about that term health is wealth, and I really do believe that because you need to have both your physical and mental well-being so that you can make the most of your later years. But we also know that it's one thing to be healthy and well, but if your finances are limited or if you don't have good social connections, you need to have a good balance between your health, your financial, and your social situation to really benefit from what I like to call that longevity dividend. And so you definitely need to have those things in place. In fact, when you actually look at studies, and there is one great study done looking at people who are 75 and older, and they found that those who maintained good social connections with others, those who maintained some regular physical activity, so got some exercise on a regular basis, and those who weren't smoking would on average live 5 years more than those people who weren't doing any of those things at all. So it really reminds you that even in later life, there are things that you can do to really benefit from that longevity dividend. And I often really am trying to work with my patients to try and keep them out of what I like to call the Bermuda Triangle of aging. Because if you're dealing with multiple chronic health issues, if you have functional and cognitive impairments, and if you're socially frail, as I like to say, you don't have really good access to good social supports, then those three things together, can really compound to create major issues. And that's why often a lot of the work I'm doing is trying to figure out where any of those issues or areas are compromised, and how do we better support people to better navigate those issues so they literally stay out of that Bermuda Triangle or as far from it as possible.
So I like this idea of thinking of it as a Bermuda Triangle, where you might sort of end up disappearing if you don't take care of yourself. But I assume the patients that you are dealing with, they are somewhere near or in the Bermuda Triangle. So how do you approach them to help them move away from that into a better sort of place?
I have a handful of patients who approach me, who have a lot of, foresight, and they say, I don't want to get anywhere close to that. So what are all the things that I can do? And for them, I really focus on these ideas of wellness and prevention. So making sure people are up to date on their vaccinations, and making sure that they have some of the advice that I've just given about making sure they maintain good social connections, and they pursue exercise and try and enjoy life in moderation as well. But for folks who are literally at the edge or really in that Bermuda Triangle, what I really actually start with is a very basic question. I just ask them, what matters most to you? Because often, a lot of us have prescribed notions of what's important to another older person. We might say, for example, that, this is what they want, or this is what will be best for them. So I really start with them asking what matters most. Because often when they have lots of complicated health issues, we might have to make choices. We might have to compromise on certain things. But often what people tell me is they want to stay healthy and independent for as long as possible. And so that's when the problem solving starts to begin. We try and figure out what are the things we can do to make sure that they're financially supported as well as possible. They're leveraging whatever financial resources they have. We make sure that they are as connected as possible in their communities through various programs and services that can help them stay healthy and independent. And then often when it comes to managing their chronic health issues, for example, what we often do is take a look at what are the issues they have. Have they been correctly diagnosed and identified? Do we have the right treatments on board? And sometimes we're in situations where they're on so many different medications. Sometimes they're actually creating what we call prescribing cascades, and other consequences. And so sometimes we actually are having to make judgments with them about what do we treat, what do we not treat, because sometimes over-treating something can actually create more problems in another area that can affect their overall quality of life. So it's often kind of spending the time doing a lot of those sorts of things. And often we can actually really do a lot of important things that really help our patients feel a lot better, and more safe and secure, and really with a much more positive outlook at how they want to approach their later years.
So Samir, I really like this conversation, because when I've been thinking about how do you design a good financial solution for people in retirement, I typically say, well, when you're young, everybody's more or less the same. You have a long life in front of you. You're going to work. You're going to pay contribution. So you can treat everybody the same. When you're getting older, people are going to have different preferences. So it's a way more complicated problem to solve also on the financial side, which I find it's intriguing how, even if you're in another field, how closely things are together, particularly when it comes to sort of what is important to people, because at the end of the day, it's the priorities that make them happy that matters. I was thinking as well, I went to a conference, and this must have been almost 15 years ago. And sometimes you hear things and it gets stuck with you. And there was this in this conference, I don't remember who it was saying it, but they showed some research and they asked people, older people, what are you afraid of? And I was thinking like, okay, probably financial. No, that wasn't on the top. Healthcare, that you will get healthcare. No, that was not on the top. But social isolation was one of the biggest fears. And that kind of struck me back then, but I realized more and more how important it is. So if you translate social isolation, what kind of impact does it have on your life expectancy?
It has a significant impact on our life expectancy, and I think this is the key. It's one thing you can think about being financially secure in later life. You can think about being healthy, but if you have nobody to enjoy your life with, well, that's not going to be very pleasant. You know, I have some older patients who enjoy their own company and don't really care to be in the company of others, but the vast majority of us are hardwired to actually want to be around other people, to enjoy the company of others. And so we recently did a survey in Canada where we surveyed close to 6,000 older Canadians to ask them a variety of questions through our annual survey with the National Institute on Aging. And what we found was that 41% of our older respondents, so these are people 50 and older, said that they were at risk of social isolation. And 58% had experienced some level of loneliness. And just to give you some perspective, we often equate severe loneliness as the equivalent of smoking 15 cigarettes a day. So it certainly can have an impact on your overall life expectancy if you're not socially connected with others. And we know that when you're lonely, it can spur on both physical and mental health issues. It can drive up healthcare utilization, and we know that it's not a unique issue for Canada, but it's something that we're seeing is a growing issue around the world. As we're more digitally connected, but maybe less physically connected with others, we're finding that the U.S. Surgeon General just recently called loneliness an epidemic in the United States, and in countries like Britain and Japan, they've actually appointed ministers responsible for loneliness because we see that this is a growing phenomenon in people of all ages, but especially in older people, where you're more likely to start outliving your family members and friends unless you have a way to continue to grow and maintain your social network.
Yeah, so it's really important when you're old and to say, don't sit at home, be out meeting people, because you need to compensate for those who sort of, die and who are in the network. I was thinking, if we would turn to the societal impact of an aging society, when you as a medical professional look at it, what would you diagnose the healthcare system? What is right and what is wrong?
When I think about the healthcare system that we have, the challenge in Canada in particular was we created our modern day system, which we call Medicare. This is the number one thing that Canadians take pride in. Just like in the UK, people say the National Health Service is one of their greatest prides and joy. The problem in Canada was when we created Medicare in 1966. It's our universal health system or system of coverage. And the problem was it was designed when Canadians were on average 27 years of age, and our life expectancy wasn't beyond our 60s. And it really covered two essential things that, say, 27-year-olds needed. It covers hospital services and physician services. We didn't actually have a system that actually created or covered key things like long-term care services, home and community care services, dental services, even medications. And so because of that, I often say that our patients have changed and our system hasn't. It works really well for 27-year-olds. If you are in an accident and you need to go to a hospital, you're going to get very, very good care for that single issue and that single situation. But if you're one of my patients who might be in their 70s or 80s and dealing with multiple chronic health issues and need access to medications, home and community care, long-term care services, and dental services, you can access all of those in one way or the other, but it's a patchwork system and it's not integrated. And often people are stuck when they find that they can't afford components that they're expected to pay on their own. So we have a very fragmented system of care. And I would say in many countries around the world, they've developed their modern day systems for a different population. And that's why we need to make sure that our systems keep up with the populations that they're currently serving.
So basically what you're saying, the key challenge for the healthcare system in Canada and probably in the rest of the developing world is that we design it for certain kind of needs, but now those needs have changed, but the system haven't. But apart from the healthcare system, what do you think we need to do to deal with this glacier of aging that is slowly coming upon us?
What we need to do is we need to start really kind of reimagining the way we're providing care. And when people hear that term, they start thinking that, oh my goodness, that means more money. And it doesn't necessarily mean more money overall. I just think it means investing the money that we have differently. And I think it's about having systems that are much more proactive, that are identifying, that they're more proactive and saying, wait, we've got an older population. We have an aging population that's more prone to issues like cognitive impairment, functional decline, and social isolation and loneliness. So why don't we actually be more proactive to help identify and prevent those issues early as possible, and help people stay more healthy and independent in their communities? When you actually have systems of care that are much more proactive and more responsive, they save a lot of those more significant downstream costs in the end. So yes, it would take probably some upfront investment in some more of the preventative aspects. But when you look at countries around the world that have actually been much more proactive and think about how they structure not only their healthcare systems but their communities to be more age friendly, what you actually see are countries that are actually moving forward. Because here's the thing: we call it a glacier, not a tsunami, because a glacier, it's coming, it's slowly creeping along. And the nice thing about our demographics, we know in Canada right now, we have about 19% of our population is 65 and older, or I like to say 65 and better. By 2031, that number it'll have grown to about 23%. And for the next 20 years, as our baby boomers, start turning 85 years and older, that number is going to stay steady. About one quarter of our population will be at that level. So we know what the demographics are. We can easily do the math. The opportunity now is to get ahead of it so that we can better support these older people in a way that won't ultimately bankrupt our country at the same time.
That sounds like a very good approach. When you mentioned you looked at other countries, do you have like practical examples of a country and what they have done to kind of put some, so we can get some feeling for what it could be?
When I've looked around the world, I mean, there's some good individual examples of what certain countries have done to address things like social isolation or loneliness, or be more proactive in terms of how they organize care. But the one country that I think has done the best job in a more comprehensive way has been Denmark. I often identify them, and in fact, their government came to me and said, "You're such a strong representative of our country in Canada and elsewhere. Would you be one of our ambassadors for our healthcare system?" So I'm officially, just to disclose that, and one of the Canadian ambassadors for Healthcare Denmark. But let me tell you why I'm fascinated by what they do. Back in 1988. They actually, talked to their people and said, "Look, we're an aging population, and the costs of caring for an aging population are escalating if we keep doing traditionally what we do in a number of other Western countries, which is warehouse our older people in long-term care settings." But here's the thing: most people, when you ask them where do they want to age, in fact, 100% of older Canadians have said they want to age in their own homes for as long as possible. And actually, providing home care for an individual is less than half the cost as what it would cost to institutionalize them. So this is one of those rare policy examples where what people actually want is actually in the best interest of the taxpayer at the same time. And it also, by creating opportunities to start being more proactive, what they do is they actually pass a law saying that at 75 years of age, people have the right to be assessed risk of her loneliness. Maybe you just became widowed, or you might need some home support. They get those interventions for you early. They get you better connected early, because by doing that, they will help prevent you becoming a client for more expensive down the road services. And by doing that more proactively, by investing more upfront in their long-term care system, which is more focused at supporting you to stay in your own home and community, they have been able to maintain their overall healthcare costs and keep more expensive parts of their system, like their hospitals, with running more efficiently. In fact, right now, when you go to a Danish hospital as they rebuild them, it's so fascinating. You meet with the CEOs, and usually CEOs like to tell you, when they show you a model of the brand new hospital being built, how many more beds they're getting. In Denmark, it's this really odd situation. Well, I love it, because they actually tell me how many fewer beds they're actually getting, because they take pride in the fact that they can do more care in people's homes where they actually want to be. So it really just shows a different mindset, but also a mindset and a way of working that actually has proved its value overall.
Well, Samir, that sounds really encouraging, and I think many countries should take a look at that. I know from my own experience up in Sweden, where my mother lives, and she's old now, and she gets care in her home, and she loves it because you have people coming around. They're very nice, and it's a social connection. So it is, I think, a win-win in many, many aspects. With an older population, people living longer, but also hopefully healthier for longer. Our previous guest, Ole Zettergren from the Swedish Pension Authority, he has a question to you related to the healthy life expectancy. But instead of me repeating that question, let's roll the tape and hear what he has to say.
I would like to ask him if this idea that retirement age should be pegged to life expectancy development is reasonable, if he supports it or if he doesn't.
So to that question, I think it's a great one, and I think it's one that we've seen has been met with incredible controversy. In Canada, the federal government tried to increase our pensionable age at which you could start claiming something called old age security from 65 to 67. And that became a political football that the new government that won rolled that back very quickly. And that was more politicized than by looking at the math and saying, why does this make sense? We just saw in France, there were riots when they proposed doing the same thing. But if you look again at a country like Denmark, it's interesting because this is all about how, in my view, you negotiate the social contract. When you actually say to folks, for example, that yes, we actually made a commitment to the current population turning 65, a number of years ago, saying that when you got to this magic age, whatever the age might be, you will now be able to get a state pension. If you now start telling the new generation that this is what's going to be and this is how we're going to support you to get there, then I think it's about being upfront about what the contract is, as opposed to surprising people and making them distrustful, thinking that you're not going to support them. Because the one challenge is I'm very supportive about saying, how do we recognize the fact that people are living longer lives than ever before? Again, 50 years ago, life expectancy in Canada was in our high 60s. Now it's in our early 80s. So the question becomes, should we think about delaying pensionable age, especially when more people are working? Yes, we should think about it. But at the same time, we have to remember that there are big changes in life expectancy as well. We know our wealthiest older Canadians, or wealthy people around the world, tend to live almost a decade longer than the poorest members of our population. So if we actually delay pensionable age for, the average Canadian, that might be fine for wealthy folks, but what about for less wealthy folks? And what about people who don't have other options to continue maintaining an income, such as being able to stay in the workforce or do other things? So I think we have to think about how we think about our longevity, how we think about making sure that we're not going to leave some people behind. And I think when we start looking at all these factors together and being able to have a more nuanced conversation, but also being more transparent with Canadians about what we're trying to do, I think that's the way that we need to move forward. Otherwise, literally, you're going to have governments that are being toppled over this issue, or other governments that are facing rioters in the street.
Yeah, that's not an easy solution to deal with. And I think also in our society where everything becomes more polarized, it's going to be a difficult thing to solve, because you need to sort of get people to realize that this is good for everyone. Doesn't matter what kind of political flavor you have. I was thinking, if you were a pension fund, because most people here are in the pension industry, and we are more on the sort of financial side of the equation. What do you think a pension fund could do to help address the Bermuda Triangle, in addition to providing an income?
Yeah, so I think the key thing with pension funds, as I understand, is that they're more prone to looking for long-term investments, for example, than say maybe other groups. So the idea is you have a large pool of funds that you want to invest, and you want to make sure that it's there for future generations to benefit from. And so this is where you can see the incredible amount of social good that pension funds can do, especially when you look at this glacier of aging. So knowing that we're going to have literally a quarter of, say, Canada's population being older people and needing a variety of care and support services, you can start thinking about, well, what would be a stable investment for at least the next 20 years, if not longer. And this is where I look to infrastructure investments. So, pension funds, have been involved in buying bridges and building other infrastructure that's going to be long lasting. And one of the interesting things I've been seeing is pension funds getting more involved into the areas of housing for older people. And so you could say, well, that could be about building more long-term care beds and long-term care homes. That could be one aspect of it, because we know more and more people are going to need that level of care. But also, when more and more people are looking to stay independent and in their own communities, you see innovative housing models that are different. They're not typical large, 4 or 5 bedroom homes, but we're talking about smaller homes. For example, in Denmark, they have this interesting housing model for older adults, where these are literally 400 to 500 square foot houses, or apartments, that are designed to be completely accessible. They are quite nice and quite comfortable, but it gives an older person an ability to move into an accessible accommodation that's affordable. And the pension funds that are involved in some of these developments, what they do is they pay for the infrastructure. They know they're going to have a guaranteed market. They're going to have guaranteed stable rents, for example, because there's always going to be demand for this type of housing. But it also creates a win-win, because now older people have an opportunity to move into a more appropriate form of housing for them that's by their own choice. And it allows other traditional housing to be freed up for families who might need it and need more space. So again, this is the opportunity to start thinking about what is the infrastructure an aging society is going to need, and how do you start being able to be a part of that and see those opportunities that really will be there at least for 20 or more years to come.
That's quite intriguing, because I see it also in for example, in Sweden as well, that it becomes quite popular with apartments that are built and you need to be 55 or older in order to buy them. And a lot of people moving from the suburbs into the city, because it's much easier to be closer to things when you're getting older. I was also thinking, like, a pension fund do have a relationship with the members. So aside from the financial part of it and investing part, do you think there's a role for pension funds to play in helping members realizing, if you don't smoke, if you take your vaccines, and you exercise, and you meet with people, you're going to live longer? And that could be a way for a pension fund to communicate and get the message over. Is that something you see?
I don't see that happening very much at all right now, but I think there's a huge opportunity for all sorts of pension funds, for example, to be able to, provide that sort of messaging and that support for their members. Because, the way I see it is, if I'm involved in a pension fund, I am absolutely trusting that pension fund with my money, with my future financial security. So there's an incredible amount of trust and support that people are putting into that fund. And so, because you already have my attention, because you literally have my money, there's an opportunity to actually use that trusted relationship to provide information, to help me understand how I can actually benefit from the financial support that I will have. What are the things that I can do to also ensure that I'm healthy and socially engaged? And so, I mentioned that Nordic study that had been done a number of years ago, showing that beyond, obviously, being financially well, that the three things that would predict longer life expectancy were not smoking, staying socially engaged, and maintaining some regular physical activity. I think that sort of advice that could come from a trusted financial partner, for example, I think would be very welcome. And I think it's a huge opportunity that our pension funds can actually play in terms of how you can actually provide information that will support people to really reap that longevity dividend beyond the finances that you're helping me to secure. So a lot of this is motherhood and apple pie. It's not controversial by any means, but I often find that there are groups like pension funds that are in very trusted positions, with our society that potentially could be doing more, and therefore build a stronger relationship with their members at the same time.
I think that's a very good observation, and I think for pension funds as well, we cannot give advice, we can give guidance and getting people to realize it. But if you can buy someone another 4 or 5 years of extra life, that's a massive good thing, a massive return for that member. And of course, if you define benefit scheme, it might be difficult because there you want people to die earlier. So you probably should give them cigarettes and free streaming so they sit at home and don't move around. But apart from that sort of morbid actuarial observation, I recall you did some research for a Canadian fund called OMERS on sort of the other value of pensions, and what were your findings there?
Yeah, so with OMERS, which is one of Canada's largest DB pension funds, they commissioned us to say, what is the value of a stable and secure income? Is there an inherent value towards having that? Kind of in a similar way to kind of an annuity. And you don't have to be a rocket scientist to realize that having a stable and secure income, and not just kind of in retirement, but we know throughout one's life, will be to support people's overall health and well-being, especially from a mental health aspect. When you're dealing with large swings in your finances and you're unable to actually meet basic needs, that can be incredibly stressful on one's own personal mental health. And that can affect your own health and well-being, especially if you're suffering from these inadequacies earlier on in life, for example. That can actually negatively impact your overall life expectancy. And so we know that there is incredible value to having a stable and secure income, but also you have to make sure that it's adequate as well. Because we do have, almost every Canadian has access to a stable and secure income in terms of their Canada Pension Plan payment. But our Canada Pension Plan payments are only 1/3 of our retirement income systems for our older Canadians. And if you're just living on that alone, it's barely adequate. It just gets you above the poverty line, but not much further beyond that. So it's not only just about having a stable and secure income, but having an adequate income, because if you have adequate income, obviously you have choices, you have opportunities to do more things with that as well. And so that's the value of kind of what DB pension plans can offer their members, and why having both stable and secure and adequate forms of income are important, and something that we need to promote more of, especially when you start thinking about people with defined contribution plans who end up with a pot of money and then they're not really sure what to do with it. Again, there's an opportunity for those sorts of pension plans to look at how they can support people with their decumulation activities in a similar way that we know mimics kind of the value that DB pension plans actually have.
Yeah, that's a good observation. I think also, if you have enough savings, you can do that. If you don't have a lot of savings, you probably have to think about, where do I get most happiness when I sort of take my money out, but have some sort of stability and predictability around it. Let's open the floor for comments and see what people have to say. And apparently my cat seems to like you a lot because he's running around here at my desk. So we have a question from Bernard. He says, we have 2 relatively aging candidates contesting for the US presidency. What can you say about their longevity, physicality, and cognitivity? Who is in a better situation and why? What does the Bermuda Triangle theory have to say on these 2 candidates? And you probably can make it more general, so you don't have to do an analysis of the 2 individuals.
Absolutely, it's really interesting now because we're in a situation here where we have two older presidents or presidential, yeah, well, one is a former president, one is a current president that are both, likely going to be seeking and competing for the presidency. And this has started to raise lots of questions about age. But I remember that famous debate that happened a few decades ago between, I think it was Ronald Reagan and Walter Mondale, who started asking about age, and Ronald Reagan, I think, famously retorted and said, "I'm not going to make your lack of experience, kind of an issue in this debate." When we talk about age, referring to his candidate's younger age and lack of experience. I think it's interesting because a lot of people are now starting to wonder about, kind of the age of our presidents, and is that then automatically linked to competence and physical ability? Certainly, holding positions like this, require a lot of energy. It requires good cognition. But I think we have to remember that today, if you make it to 65 in our society, you have at least 20 years of life expectancy left ahead of you. And for many people, almost 1 in 10 people who make it to 65 now, we expect that they might even make it to 100. So this idea that, could one of these, potential presidents die in office? Well, yeah, potentially, but I don't necessarily think that's necessarily on the horizon. But I also think about when you think about that Bermuda Triangle of aging, when both candidates, are always declared that they're healthy and well, that they don't have any major illnesses, that's a good forecast for the future. But it's also about making sure that one is maintaining, good physical health. They're eating as well as possible, and that we're making sure that that they're currently fit to do the job. And right now, as far as I know, both are, meeting the physical requirements. And so we should really then feel confident that we should choose the person that we actually think has the best policies and the best chance. But I think more and more we're going to see increasing questions about fitness to lead by age. And I think we have to remember that there is not an expiration date. Everybody ages differently. And more we're going to be seeing people living into their 80s, their 90s. And we have to remember that centenarians, or people living over 100, are now the fastest growing segment of our population. So people, if you want to think about one of the greatest heads of state that we recently lost, it was the Queen of England, who made it till 97. And frankly, I think was still greeting the latest British Prime Minister literally a few days before she passed. So it just, when people think about, are these two people fit to be president? Well, I point to the Queen and say, look, she had a good go of it right till the age of 97. So, don't just think about age, think about all the other aspects that go with it.
And also, age could be a sign of wisdom. In the old days, if you've been a long life, you learned a lot and could share it. Do you see this trend in other places, or are people working longer? I assume among academics it's the same as among these presidential candidates. They can work for quite a long time. Do you see it anywhere else, or is it more like an exception to the rule, what we see?
No, I think in general, like, we see lots of more people who are working into later life. And I think, again, it's this idea of having a sense of purpose and what matters most to you. We used to have this famous saying in Canada and perhaps the US, with one of the big kind of insurance companies, that used to talk about Freedom 55, almost encouraging people to take their pensionable benefits earlier and actually retire early. And then people realize, my God, if I retire at 55 and I might be living to 85, that's 30 years of life to kind of figure out what I'm going to do and how I'm going to stay engaged and interesting. And so often you find this phenomenon where people retire for a year or two and then they're back in working at age 58, because that was, they have a lot of energy and a lot of interest to contribute. We have certain professions, where there is mandatory retirement. I think, certain types, Canadian senators, I believe, have to retire at the age of 75. I think judges have to retire, I think, at the age of 75. And I sometimes question kind of that logic to a certain extent. But we do see more and more people who are working well into later life. And because they're interested, they want to stay engaged. They enjoy what they do, and certainly, physicians, there's no retirement age on them. But we have to also make sure that if people are in professional roles or roles where their actions can have implications for other people, we have to have safeguards in place to make sure that a person is still capable of doing their job well. I think the converse of this is that we see more and more older people who are also working, but not because it's what they want to do or love to do, it's they're forced to do it. If they did not actually save up the finances that they would need to live the long life that they're living, if they're dealing with limited savings and now growing and mounting costs, you're seeing more and more people having to stay in the workforce or return to the workforce to try and make ends meet. But that works well for those who can and are forced to do it. But for those who have to do it but can't because of physical or other limitations, you really see where that where things really start to fall apart. And so this is where, again, we have to kind of figure out, how do we support people so increasingly people have options as they age, and if they want to continue working, we should encourage that, especially in a current market where we're seeing increasing labor shortages as well.
Definitely, and I think with an aging society and fewer young kids being born, I think we need to work longer, and there are going to be a lot of empty spaces to fill when we have a lot of people retiring early. So thinking in terms of education and getting people productive, a lot of us spend a lot of time before you start working now, going through university and other things. And then, of course, it might actually make sense to work a bit longer. We do have a comment here from Gareth. He says, staying on the Denmark theme, some of the Danish pension plans, such as PFA, are focused on helping on providing a good senior life and building senior communities for the retired members. Would welcome your insights on opportunities in this space and in building communities that are more conducive to aging in place. So basically, I think Gareth is looking for a bit more insights on how would this work? How would these communities look like?
Yeah, so again, I think for a lot of older people, they want to stay healthy and engaged and independent in their communities for as long as possible. If you ask where people want to age, we know that in Canada, for example, 60% of Canadians said that they had changed their minds during the COVID pandemic as to whether they'd want to move into a long-term care or retirement home. But what they do want to do is stay in their own homes or in their own communities. And I think this is where there's an opportunity to say, right, if we want people to stay in their own homes and communities, for example, do we have housing options or more appropriate housing options that will better meet their needs? One of the challenges is if you live in a multi-story home and you now have to navigate stairs with bad knees, that becomes a non-option. People want more single-story setups, and they want things that are actually the appropriate size for them. We often talk about people often being overhoused as they age. They might have bought a home that was appropriate them to raise a family. They might have had a few children and therefore they had a few bedrooms, but now it's just them. And they don't need all of that extra space, but they want to stay in the neighborhood that they've grown and built communities with. And so this is where you start thinking about the opportunity to say, build housing models, for example. It could be in the form of an apartment building. It could be in the form of a small housing estate or mixed housing, where you can start integrating this sort of housing into existing communities. And this kind of supports this model of what we call small long-term care homes that literally look like just large houses that are anchored in neighborhoods, as opposed to being a large institutional setting or a community that's kind of on the outskirts of a neighborhood. Nobody wants to be ghettoized, and nobody wants to be warehoused in kind of an institution. But I think this is where there's an opportunity for pension funds that are looking to better support their members and an aging society to build housing models that would be attractive. And I think there's a lot of interesting things that could be done, and especially would work well for pension funds that are interested in more longer term investments, especially the things that can be flexible and that can be used for different purposes in future, if as an aging population, comes and goes, over, especially if you're looking at decades down the road as well.
Yeah, especially because the building can last for quite a long time. So it's good to have multi-purposes. I recall in Netherlands, there was an experiment where they basically had elderly homes and student homes together. And apparently it seemed to work quite well, actually.
It does, because again, this is why when people are talking about senior communities, right, they say we're going to go and build this community where you can live with a bunch of other older people. Some people are all for that, but a lot of my older patients are like, I don't want to go and just be around other older people. I like the intergenerational connectivity. I like being part of a community. And so I was absolutely blown away. The most perfect example that I fell in love with, and that we filmed for our national news program in Canada called The National with the Canadian Broadcasting Network. It took me and one of our lead reporters to Denmark to film at Generation House, or called the House of Generations in Aarhus. And it's amazing. It's part of a community on the waterfront. There's 14, if you will, condominium towers or apartment buildings, but the one right in the middle, it's this 15, 20-story tower. It has 400 units in it, but it has units that are nursing home units, if you will, apartment units. It has supportive housing units, or just homes, accessible homes for older people. But it also has homes for families. It also has homes for people with disabilities. And on the ground floors, it has a library, it has a gym, it has a coffee shop, it has all this. It's such a hive and a daycare, and it's such a hive of activity. And what you naturally see are people who wanted to all deliberately move there to be part of an intentional community that is multi-generational. And, I met this older lady who was, suffering from, severe loneliness in her own house, in her community. She desperately wanted to move here, and she loves it. And she says, I live next door to a family. And she says, when they need babysitting, I love to look after their young children. And she said, and in return, when they're going out to the grocery store, they go pick up things for me. She said it's a win-win for all of us. And I could give countless examples of what I saw in terms of intergenerational connections, but everybody there was living and thriving, and were so excited to be part of a community. And that was an intentionally designed building that will last for generations and support multiple generations, that would benefit. So it's an example about creative housing solutions that are not just focused on older people, but people of all generations, and allowing them all to benefit from being in a community that allows them to all live and be together.
I think that's a very good reflection and comment from you, that it's really important to be in a community and be around people of different ages, because that's how a society is. And you shouldn't just lump people together of different ages in different areas, because I think everybody going to miss not having the combination. We have a question from Nima. He or she says, relating to the theme of an aging workforce, how do we adjust for a society where retraining is increasingly required, with the potential of AI to displace more workers? How would we structure economic support for later in life retraining?
It's a great question, because I think, again, as we start thinking about this idea that we're living longer and that people want to have purpose in their lives, and that purpose could come, in later years from saying, I'd like to volunteer. I'd like to just look after my grandchildren, or I'd like to stay in the workforce, or do other things. But ironically, we've created these various barriers for a number of reasons over time. I was just reading a colleague's forthcoming paper, and they were talking about this interesting phenomenon where 20 years ago when we had a labor surplus, for example, and we're trying to say, how do we get people out of the workforce earlier? They created, pension carrots, saying you can take your pension early, you can do, you can retire early, and almost kind of wanting people to leave the workforce to make room for other workers. Now we're dealing with massive labor shortages, and we have people who are leaving because they've been conditioned to leave when we want them to stay. But we've made things difficult because, number one, as Nima notes, how do we create retraining opportunities that allow people to retool and retrain so they can still contribute, but in an interesting way? But also, how do we also create these or take away these barriers, for example, where some of the pension programs that exist, for example, don't really it doesn't really work well if you continue working, because sometimes your pensionable benefits are based on your last 5 years of earning and kind of averaging that number out, as opposed to, or don't allow you to collect your pension and still actually work at the same time. I think there's a huge opportunity here where we can start looking at how do we allow people to continue to work and contribute without worrying about a clawback or a mechanism happening. How do we actually create more work opportunities that are more flexible and recognize the changing needs of older adults? They might want to stay working, but they might not want to work full time because they have other obligations and interests they want to pursue. And then how do we create retraining opportunities that allow people to gain new skills, try new things, and recognize, as you pointed out earlier, Stefan, the idea of the incredible wisdom and experience that comes from an older worker who just has been around the block so many times. They can tell a younger worker, don't do this, trust me, I've done this so many times. Finding different roles for these folks in terms of mentors and advisors and things that may lessen kind of the physical demands of a job, but really benefit from the intellectual capacity that these older, more experienced workers have. And I feel like that's how we reimagine the future of work, especially for an older population, can help support labor issues, can help support later life income opportunities, and better enable an aging population. So this is something where there hasn't been a huge amount of work, but I think as we think about the future of work, we have to think about the pension challenges related to this, and also kind of how we've actually conditioned our workers to retire early and not really thought about how we can maintain experienced older workers, perhaps with new skills as well.
And Samir, that's a good thing. Also, for all of us who are working, who are not reaching state pension yet for many years, it might be a good idea to think about, should I start re-educating myself now so I'm ready when I'm getting older to be prepared for another type of job, so I can actually stay active, work longer, have a good social network. So you might actually say that to survive the Bermuda Triangle, it's actually quite a good thing to continue to work, because you're going to have a lot of checks and balances in place. Well, Samir, you have been very good answering the questions from the floor. And now is your time to ask a question to our next guest. And our next guest is Professor Yaakov Ben-Haim, and he's from Technion, which is Israel Institute of Technology. And Yaakov, he has made a lot of work in the field of planning and making decisions under uncertainty. And he's especially known for the info gap theory. And I think it would be interesting for you to say, what question would you like to ask him, being sort of expert in a tool to make decision and planning under uncertainty?
My question for Yaakov would be really about a challenge we have in Canada right now. And it's this idea that while Canadians can start taking their Canada pension plan and Quebec pension plan benefits, early, we know that the longer they wait, the more they delay the age of claiming, from say as early as 60 to as late as 70, they can actually have more safe and secure income, later in life. There's a real benefit from delaying taking your pension. The challenge is that less than 1%, or about 1% of Canadians actually take advantage of that benefit. They wait till 70. most take it early on. And it all makes sense as to why you should do this, but people don't make that decision. And it's hard, because we just say financial literacy if the information's out there, Canadians could do this, but they don't. And so what are the mix of, kind of boosts and nudges that we need to actually do to help people make difficult financial complex decisions? Does he have the magic solution? Because people here in Canada are scratching their heads as to why we're still having so many Canadians not take advantage of delaying claiming their CPP, and really having more safe, secure, and reliable income for their later years.
Thank you, Samir. And I would have to say to you, it's been a pleasure to have you as a guest here. I find this discussion extremely exciting because it is more than just finance. Health is wealth, particularly when you're getting older, and having a good combination of it, of health, social connection, and some money to spend is probably the recipe for a long and happy retirement. So, and also would like to thank everyone in the audience for coming in and asking your questions. That's really important, I think. And it was a couple of really good questions today, so I feel quite excited about it. But once again, Samir, thank you very much for having you here, and it's been a pleasure.
Thank you for having me, Stefan.
Yeah. And thanks, everyone, and hope to see you next time, which will be on March 21st at 2 p.m. UK time, when we're going to have a conversation with Jakob. Until then, bye.